If you're on testosterone replacement therapy, do you need to also be on HCG? For guys who are considering TRT, this may be one of the most common questions that we get. The first and most common reason that guys do want to typically pursue HCG as part of their TRT protocol is the obvious one, is because they're worried about their sperm count, they're worried about their fertility. So when you inject HCG, what it does is it stimulates the Leydig cells inside the testicles to produce testosterone. And when this intratesticular testosterone is produced, what it's going to do is it's going to have a effect on the neighboring Sertoli cells. And by having that effect on the neighboring Sertoli cells, it's going to therefore stimulate the Sertoli cells to make sperm. What effect it will have on you, who knows? It affects everyone absolutely differently. And unfortunately, we can't predict if or how well it would work in a given person. Best thing we can recommend, though, is if you are concerned, get a semen analysis, see where you're at. You may not even need HCG as an adjunct for this scenario. A lot of guys that we have that are on TRT get a semen analysis, and in fact, they're still producing adequate amounts of sperm, and they don't even need HCG. On the other hand, we've seen guys have sperm counts while on TRT, 4 million, 5 million, 6 million. Then they get on HCG, and sometimes they get up to 40, 50 million. Great. That's an extraordinary clinical response, but I won't necessarily say that's par for the course. Again, we can't really predict what you will look like. Now, it made me go up to about 40 million, where I was, somewhere in the ballpark of sub 10. So for me, that was a very substantial clinical response. Another typical, commonly anticipated reason why guys would want to get on HCG is to reduce testicular atrophy. We already know that once you get on testosterone, you possibly could have some testicular atrophy due to the introduction of an exogenous hormone. We know that it's been known for 100 years now. Now, not everybody will experience atrophy. We always interrogate our clients. We always ask our patients, are you experiencing any atrophy? I would say probably in the ballpark of maybe about 20-25% of our patients actually do admit to some degree having some atrophy. Historically, we just assumed everyone would experience it. But again, about 20-25% of our patients say they actually do experience atrophy. With that being said, what we are starting to see in a small fraction of patients is them becoming somewhat refractory to HCG. In other words, let's say we've got a guy that's been on TRT for a few years and he's been on HCG for a few years. In a small subset of patients, we're seeing them to where if they've been on HCG for an extended period of time, indefinitely, some of them actually become refractory to HCG. In other words, it's not helping with the atrophy anymore. It seems as if they're actually becoming tolerant to the benefits of HCG in terms of atrophy. Now, again, we don't see that a lot. It's just been in a small set of patients, but it is something to be mindful about, something to be cognizant about if you're going to be in HCG indefinitely. And the third use for HCG that we've seen in our clinic and our practice is that for some guys, guess what? It actually can enhance sensitivity in terms of, yes, penile sensitivity. So say if you got guys who do have some decreased sensitivity, say it's not due to psych meds, it's not due to high prolactin, not due to excessive masturbation or anything like that, but just a small decrease in sensitivity, the introduction of HCG can sometimes help increase sensitivity as well as orgasm intensity. So that was a quick primer on some of the different utility, some of the different uses, benefits of HCG, especially in a TRT setting. If you enjoyed this video, found it useful in any way, shape, form, give us a subscribe and keep your eyes peeled for more content. Thanks.